genes versus epigenetics, or genes versus nutrition. If someone has the gene of ADHD or has the gene of depression, let's say he's not having enough dopamine or serotonin in his or her brain, is nutrition enough to help this patient live a normal life or have a good quality of life? Or medication is a must, and then we will talk about nutrition. So
That's a
genes or
really good
nutrition?
question. Yeah, I think that's a really good question. I think regardless, it's a case by case basis for the patient. In terms of depression, obviously, if they're, thinking about self-harm, or if, it depends on what state they're in, medication can really be a life-changing intervention. And so that can really be a very helpful kickstart to, their care process, their healing journey, right? And so I think that nutrition, naturopathic medicine, or functional medicine can and should be used. I think it's, again, it is that case by case basis where if the person is in, a really challenging situation, they may very well benefit from that medication immediately so that they can get some kind of symptom relief so that they can actually start to do some of these dietary changes and exercise and things like that. Sometimes it does take a pharmacological intervention to get that process started. But I do think inevitably, the nutrition, blood testing, things
Yes.
of that nature, supplementation, those all should be used as well.